Colesevelam Hcl is used to lower cholesterol in people with high levels of cholesterol in the blood and to help prevent heart disease, strokes, and heart attacks. It is also used to lower high blood sugar in people with type 2 diabetes, which helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Taking colesevelam along with a proper diet and exercise is important for its effectiveness. It belongs to a class of drugs called bile acid-binding resins and works by removing bile acid from the body, which then causes the liver to make more bile acid by using cholesterol, ultimately reducing cholesterol levels in the blood. The optimal time to take this medication may vary, so it's best to consult with your healthcare provider. When taking Colesevelam Hcl, it's important to follow your doctor's instructions. This medication is usually taken 1 to 2 times daily with a meal. If you have trouble swallowing the tablet form, talk to your doctor about switching to the powder form. If you're using the powder form, mix the contents of 1 packet into a glass with 8 ounces of water, fruit juice, or diet soda. Stir the mixture well and drink all of it. It's important to take this medication regularly at the same time each day to get the most benefit from it. Keep in mind that it may take several weeks before you notice the full benefit of this drug. Also, colesevelam may decrease the absorption of other medications you may be taking. Make sure to take other medications as directed by your doctor, usually at least 4 hours before taking your colesevelam dose. If you're not sure when to take your medications, ask your pharmacist for guidance. If you experience constipation or upset stomach, it's important to let your doctor or pharmacist know. To prevent constipation, make sure to include enough dietary fiber in your diet, drink plenty of water, and stay active with regular exercise. Your pharmacist can also recommend a suitable laxative if needed. It's essential to remember that this medication has been prescribed to you because the benefits outweigh the potential side effects for your specific condition. While many people using this medication do not experience serious side effects, it's crucial to seek medical attention if you experience nausea, vomiting, stomach pain, trouble swallowing, or unusual bleeding/bruising. In rare cases, a serious allergic reaction may occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek immediate medical help. If you have diabetes, it's important to be aware of the potential effects on blood sugar levels. Low blood sugar symptoms can include sweating, shaking, fast heartbeat, hunger, and blurred vision. On the other hand, high blood sugar symptoms may include increased thirst, frequent urination, confusion, and fruity breath odor. It's important to monitor your blood sugar levels closely and discuss any concerns with your doctor. As with any medication, if you experience any other effects not listed here, it's advisable to reach out to your doctor or pharmacist for guidance. Remember to take your medication as prescribed and seek professional advice if you have any questions or concerns. Before taking colesevelam, it's important to talk to your doctor or pharmacist about any allergies you may have. It's also crucial to discuss your medical history, especially if you have a history of pancreatitis, high triglyceride levels, trouble swallowing, stomach or intestinal disorders, recent major intestinal surgery, or hemorrhoids. Since this medication can interfere with the absorption of certain vitamins when used for a long period of time, your doctor may recommend taking a multivitamin supplement at least 4 hours before taking your colesevelam dose. If you're using the powder form of this medication and have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this medication safely. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication as a precaution. Now let's talk about how to use Colesevelam Hcl. It's important to be aware of any potential drug interactions that could affect how this medication works or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Colesevelam Hcl include raloxifene and warfarin. It's also important to note that beta-blocker medications may prevent the fast or pounding heartbeat you would usually feel when your blood sugar falls too low. Other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are unaffected by these drugs. Furthermore, many drugs can affect your blood sugar, making it harder to control. Before making any changes to your medication, be sure to talk with your doctor or pharmacist about how it may affect your blood sugar. It's important to check your blood sugar regularly as directed and share the results with your doctor. And be sure to tell your doctor right away if you have any symptoms of high or low blood sugar. Your doctor may need to adjust your diabetes medication, exercise program, or diet accordingly. As always, it's best to follow your healthcare provider's instructions for the best results. If you suspect an overdose and the person has serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. While taking Colesevelam Hcl, you may need to have lab and/or medical tests, such as blood cholesterol levels and blood sugar, to be done. Make sure to keep all medical and lab appointments and consult your doctor for more details. To help this medication work better, consider making lifestyle changes such as exercising, quitting smoking, and following a low cholesterol/low fat diet. Your doctor can provide more details on how to make these changes. If you have diabetes, attending a diabetes education program can help you learn how to manage your diabetes with medications, diet, exercise, and regular medical exams. It's important to also learn the symptoms of high and low blood sugar, as well as how to treat low blood sugar. Be sure to check your blood sugar regularly as directed and share the results with your doctor. If you forget to take a dose of Colesevelam Hcl, take it with a meal as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When storing Colesevelam Hcl, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that's not the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of Colesevelam Hcl, it's important to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.